Hi, I'm Gail Mill, Sales and Marketing Director for PhysioTools. PhysioTools is a program that enables you to easily create personalized exercise handouts for your clients. We work with world-renowned authors and publishers to bring you the latest content, and today I'm talking to Joanne Elphinston, author of our latest module, JEMS Dynamic Movement Progressions for the Trunk and Lower Body. Hi Joanne, nice to talk to you. I would like to start by asking, how does JEMS differ from all other movement control concepts?
Okay, that's a really good question, Gail. I think there's probably three main elements that I would probably put into this question. The first one is that many of the motor control concepts have evolved to look at very specific control of isolated joints or isolated muscles. And then the hope is that this will then be taken by the patient and transferred into function. And we can definitely see that there are papers there to say that we can activate muscles in these ways, but transference to function, the evidence base is a little bit more patchy. From a JEMS perspective, what we tend to do is instead, right from the beginning, work on relationships between body parts and relationships between systems. Because even if you have activated a certain muscle or achieved a certain type of joint motion, to be able to transfer that into function, lots of different things have to be able to happen. So we need the ability to take the right body part to the right place at the right time. So we've got that coordination through the kinetic chain. We have to have the fine neuromuscular control to make small adaptations to the fluctuations that happen in our body. Of course, we need the proprioception and awareness to be able to sense that that's happening. So a whole lot of things have to happen to transfer a certain type of contraction into movement. So if we start with integration instead, and we can start with it at really low levels, we can start at whatever level the patient is. So we can use it for neuro, and we can use it for amputees, and we can use it for post-surgical patients, and then we just progress it just very gradually all the way through to wherever the patient needs to go. So the first thing would be isolation versus integration. The second would be what the objective is. So is control your objective, or is more normal movement your objective? For us, I see a lot of patients who've had a lot of treatment and they're actually over-controlled. So there's no spontaneity and dynamism in their movement. So our overall objective we keep in mind all the time, and that is we're looking actually to help people to move better, rather than putting our focus on just the control aspect. And then finally, it's about the cueing. It's about how you help people to learn to do a technique. And traditionally, it's been very cognitive. When we teach, we give people instructions, and sometimes they get a bit worried about whether they're doing it right or wrong. What we would tend to do with a JEMS approach is actually work that through awareness. So if something isn't exactly as you'd perhaps like it to be, we'll call the patient's awareness to some part of the body and say, I wonder how that feels. What do you feel there? And I wonder what would happen if we move that little bit, and would that change the feeling? So they actually start to learn self-awareness. And that's great, because when they come back to you the next time, they usually come back to you saying, oh, I noticed this, so I found that out. So they start to do your work for you, but you're not just teaching them an exercise, you're teaching them a skill that they can then use in all kinds of parts of their life. So the first one was isolation versus integration. The second one was control versus optimizing or making the movement more beautiful, more easy. And the third one is cognitive cueing versus awareness cueing. So there's a few differences, I would say, between them.
Thank you. Can someone who's not attended a JEMS course take advantage of the JEMS exercises in PhysioTools?
Oh, yes, absolutely. Now, although something like PhysioTools, the home exercise software, that's something new for me. Obviously, over the years, I've written quite a few books teaching exercises, and people have been able to communicate back and say that they've been able to find these helpful for themselves and their patients. So I know these people haven't necessarily done courses with me, but they've still managed to find the concepts and the techniques useful for them. Obviously, yes, of course, if you do the training, then you get to deepen your use of the techniques, your clinical applications, your cueing, your facilitation. But that being said, one of the key things about JEMS is its simplicity. So even if you haven't done any other work with the concept, then it's not too difficult to actually look at them, see what you can start to achieve with them, and actually use them for the benefit of the patient. So yeah, it should be able to be usable by everybody.
So how should somebody unfamiliar with JEMS start using the JEMS module?
The first thing I would say is to put your mindset in the right place. So where perhaps you might have looked for something that was to strengthen a certain muscle, now you're going to ask yourself, what is the function that I want to improve? So for example, if you have a patient and you want to work on their gait, and you want to work on their stance phase, so that's the body's ability to accept weight, that is the function you're trying to work towards. And the more traditional thinking might be, well, if we strengthen the glutes, then they'll be able to do that better. From a JEMS perspective, we would say, well, actually what we need is the entire chain to understand how to work with itself. So it changes what you look for in the exercises. So instead of perhaps going for a wall squat, which you might think, oh, I'll use that for strength, instead, you'll think, no, actually, I'm looking for the body's abilities to support. So you might find something that's more like a ball press or a supported lunge, which unloads the body a little bit so that it can find some new options. So it makes a difference in the exercises that you select. So I would say coming away from muscles and into whatever the functional task is that you want to improve.
Thank you. That's a good explanation. Can you give an example of the movement dysfunctions and most suitable exercises?
Oh, there's so many. I could talk for days about this. But if I just pick one, because it'll be familiar to everybody. One of the foundation principles that is really helpful to help someone to take back their movement is this concept of having a central longitudinal axis in the body. So it's an imaginary line, and it gives us a reference point for the planes of movement. But most of the patients who come to us don't have a secure CLA. So what happens is they either collapse in the sagittal plane, so they collapse into flexion, or they're held up in extension, or they're collapsed into side bending, or perhaps even into rotation. So they don't have this reference point to work from. But traditionally, people tend to work that from the center. But what we would say is that the trunk can only be where the pelvis puts it. So if your pelvis is tilted in one direction or another, your trunk has no choice but to adapt to that position. So trying to get control of that isn't going to work once you put it back on the pelvis and then the person actually stands up. So what we would say then is that if you want a pelvis to work for you, first you need a foot to stand on, because the reflexes in your feet are what drive that wonderful anti-gravity response from the lower limbs. So actually we would start with a really key JEMS exercise called a listening foot. And the key to that is to release the tension in the foot and allow it to actually find the ground, to sense the ground and send good quality proprioceptive information up into the central nervous system. And from there, we did progress them into that lovely support mechanism that I talked about previously, so that the patient actually has something to put the pelvis on. But it may also be that maybe they've got a bit of a restriction in hip rotation or hip adduction. So when they sit, their pelvis is unevenly weight-bearing, so that would put you into a side bend. And maybe we just need to do some nice lateral tilts of the pelvis to actually mobilize the hip and then lengthen that side of the body to help the patient find a level platform to put their trunk on. And once you've done that, then you can challenge the trunk. It gives a lovely platform to support the upper limbs as well. To have that CLA, then we start to work into the other more obvious things like balancing. We've got too much tension in the erector spinae, not enough going on at the front. Finding that CLA actually helps you to start balancing that muscle pattern. So it's just one of the examples of something that everybody would see commonly, and then how we would go about addressing that kind of an issue.
Thank you. In the module, you say that it's an effective method which targets the body's efficiency of motion and addresses physical performance as well as injury prevention and rehabilitation. I wondered whether you could explain in your own words what you actually mean by that.
Okay, so what I usually find with people, they come in usually because they're injured. But what then happens, a little way along the track, they come back and they say, it's really interesting, but that I just find things easier to do. And if they're athletes, they'll come back and tell me that they've made improvements in performance. And basically what it is, it's about when you help someone to get out of their own way and to move more beautifully, it's about how you manage the forces acting on your body and how you create the forces and then how you control them and move them through the body. So if you can do that really well, then you don't focus stress on any particular body part. So you can start to influence the pain and the injury, but also it means that you're moving in such a way that as those forces move through the body, that then decreases your effort and puts everything in the right place to help to propel you, which then makes you more efficient. So basically, if you start to move better, it has effects in both directions. And it's so lovely for people who sometimes have a very humble goal of just not being in so much pain. But they come back and they start to tell you that they've started to explore doing new things and things they hadn't thought of doing before, or things that they thought were hard and they're just not that difficult anymore. And that's a real pleasure because then you know you've made a really lasting impact for people. So moving well, it's about keeping the forces balanced in a way in your body so that it doesn't amplify anywhere and cause stress on a body structure. It also means that you're finding the most optimal way to use yourself, which then makes you more efficient.
Thank you for that explanation. That's great. Well, thank you very much for your time today. I really appreciate it, and thanks very much for working with PhysioTools. If anybody wants more information about the JEMS module, please visit our website, physiotools.com. Again, thank you very much, Joanna, for your time.
Oh, my pleasure. Thank you so much, Gail.
Thank you. Bye-bye.